I've been having a problem initially. After 2 years, I decided to go and see a physician. So I was taken for a surgery. The first surgery, they removed the fibroids. After 4 days, I developed complications. I could not breathe. My BP was low. I was rushed again to the hospital. And then they had to open the same wound where they had cut to remove the fibroids. Then I was discharged after around 2 months. Then I was told they could not repair the issue of urine because I was so weak I could not go for another surgery. So since then I went back to the house. I stayed again for 5 months without going to work. I lost my self-esteem, I lost my confidence, because again you don't know how, if other people are seeing that you have pampers, and when I feel it is always swollen, and I thought everybody was seeing that pampers. Financially it has really drained me, because I had to spend 1,300 every week. And sometimes even relating to my kids, because when I sit in the sitting room, you want to stand, you go to the bedroom, you wonder, the boys, my sons, what have they seen, what are they thinking about? And sometimes it would even force me that I send them pampers at the supermarket. And I would imagine now my sons and buying the pampers, it has not been easy for me. Again, relating with people in the society, it's very hard to share. Actually, it was very hard for me to share, even with my workmates and my friends, because of the stigma. What will they think about me? You know, it has really interfered with my relationship, even in at my family level, because, you know, the man sometimes, my husband will just, you know, he disappears and he comes back. So, you know, you can't even ask him where he was, because again, you know, there's nothing you can do. So maybe he's gone to get what he wants to get outside.
Hapa ni tunapokea wagonjwa wenye walipata shida wanapokuwa wakisa. Na shida zenye wanapata huwa saa zingine makojo inatoka ama wana shida ya kutoka kinyesi. Hasa wanapokuja tunasaidia, wanapelekwa theater, wanatengenezwa hiyo shida. Alafu tena pia wakienda nyumbani tunawapea advice wasifanye kazi nzito anapoenda nyumbani. Pia anapoenda nyumbani anaambiwa asipande pikipiki, kwa sababu pikipiki anapoenda itamtingisa, alafu tena anaweza kupata hiyo shida tena ya hiyo fistula. Huwa tunawakataza.
Culture is one of the most predominant causes of obstetric fistula. I can just pick one like female genital mutilation. This condition can cause direct injury to the urinary system, or it can actually allow a girl who is 10 years old who has been circumcised to be married off immediately. And this girl goes ahead and gives birth at that tender age of 12, 13, 14 years old. And at that time she is actually at home trying to push her baby when she's so small and the baby cannot pass through the reproductive system. At the end of the day, the baby is stuck there, baby dies, and then when they perform a cesarean section, the baby passes out as a dead baby. The fistula has already formed. Another one is where the women have no say in society. The mama is in labor, she cannot go to hospital until the husband gives permission, or she's not economically empowered to take the transport and go to hospital. So if she's not able to have that power to get to the hospital when she's in labor, she's waiting for her husband who is not even there. Then she gets obstructed labor and then she gets fistula. So the women they are not empowered to actually make a decision, especially when their own bodies, especially when they are pregnant. It's free of charge. When you look at the fistula patient and the kind of damage they get, some of the young girls of 18, 20 years old actually get permanent disability. That means they lose their uterus, their womb, they lose their reproductive system, so they cannot have even a relationship. They cannot have another baby. That baby died. They undergo through many operations. They undergo serious trauma. They are actually what we call near-miss death. They just missed death by a whisker. And if the government was put in place practical systems around maternity, safe maternity, evacuating these girls to the hospital in time, even simply allocating enough funds for even from national insurance cover for these women. Some of them do not have ID. 60% of the patients don't have an ID card. can't even pay for the NHI even if they had. So I think the government probably should move towards really looking at a wholesome package of taking care of these women right at the antenatal, so that they have a safe maternity, they escape fistula. But if they get fistula, because even surgically when a patient goes for an operation, inadvertently the patient can get an injury and get a fistula, which is understandable and can be fixed. But for prevention, I think the Ministry of Health should actually come up and not put it on paper, but put it in practice. The message I can give doctors is that fistula is manageable up to a rate of 85% success, and with training over and over and over again, a doctor can become an expert in fistula care.